is Jessica DeMassa, and I'm at the HISA Studio here at HIC 2017, and I'm with Jayne. Jayne, please introduce yourself for everyone watching.
My name's Jayne Barclay. I'm a HISA member. I'm also on the Clinical Leadership Network representing medical imaging, and I'm on day 3 of the conference here. It's been really great.
Fantastic. Well, tell us a little bit about enterprise imaging and what's going on there in that space as far as some of the new innovations that are happening around informatics. What are you excited about?
So traditionally, imaging has been quite siloed, as a lot of healthcare has been as well. Radiology, cardiology, ophthalmology. Obviously, there's great benefits of bringing that all together. So that's a big thing that's happening at the moment. People looking at it from an enterprise perspective instead of the single departments. The other cool thing that's really coming along at the moment is capturing things like clinical photography in hospital departments or even in primary care and bringing that into the enterprise imaging realm as well, and new workflows with that. So traditionally with things like radiology, you would get a request form, someone sent an order, and that would come into our systems. With clinical photography, it's really ad hoc, so it's sort of just done on the spot, and traditionally there hasn't really been much thought about how that's captured and stored, so
Sure.
That's going to be a huge thing coming out. We're seeing lots of apps that are being developed to cater for that, so that's something I'm really excited about at the moment.
That's fantastic. And so what is the benefit to having that integrated into a patient's chart?
So it gives a better perspective and a longitudinal view, I guess, of the patient. Not only, so obviously in the electronic medical records at the moment, we've got a lot of text and data in that way, but from a visual perspective, you can get a lot of information and like a timeline of what different imaging examinations have occurred over time. So yeah, it's not something that traditionally has been done, so I think we're going to see a lot of benefits that we probably don't really realise at the moment as well.
And what about artificial intelligence as far as radiology is concerned? I know that's been a really hot topic and a lot of the deep learning machine technology there. What are your thoughts on that? What's going on?
So I've got a really big interest in that, and I can see it becoming really useful for clinical decision support mostly, not taking over the role of radiologists,
Right.
but probably more helping out physicians in other departments, particularly like maybe the emergency department when you've got a chest x-ray that's come in, and a lot of the times overnight they might not be reported by the radiologist, and the emergency physician would be making the diagnosis on the spot. If that data was to go through some sort of machine learning engine and spit out sort of its recommendation of whether there's a critical result maybe with that image, I think that would really support emergency physicians, for example, and probably there'll be a lot of other applications like that as well. So I think that's a really exciting space that we're going to see really develop over the next couple of years.
That's fantastic. Jayne, thank you so much for joining us in the HISA Studio and sharing a little bit about what's exciting as far as enterprise imaging is concerned. We love hearing your perspective. Thank you so much.
Thank you very much.
I'm Jessica DeMassa here at HIC 2017.